Otitis media is an infection of the middle ear canal. The middle ear is like a little box deep inside the ear canal with a drainage pipe called the eustachian tube, which drains to the back of the nose or the nasopharynx, as you can see here. In our babies and little kids, the eustachian tube or this drainage pipe is not fully mature and may not drain appropriately. In our older kids and adults, the eustachian tube could be blocked from congestion or drainage. This can lead to a buildup of fluid in the middle ear, which then causes the pressure in that little box to increase. And this is what causes the tremendous pain that's associated with the middle ear infection. Additionally, this fluid can get infected with viruses or bacteria or fungi. When a doctor looks through the otoscope at the eardrum, this is what he sees. A normal eardrum will not be red or inflamed or bulging or retracted. A middle ear infection will look similar to this with a red bulging eardrum. It is very important to treat pain with ibuprofen and acetaminophen. Remember, these are not just for fever, but also for pain and discomfort. The majority of middle ear infections can resolve without antibiotics. In mild cases, it is very reasonable to consider no antibiotics and repeat evaluation in 2 to 3 days with your primary care doctor. However, we recognize that this may be difficult to get scheduled, and so your doctor here today may write for what we may call a back pocket prescription for you to hold on to and only get filled if symptoms get worse or continue after 2 days. It is important to note that ear drops are not a treatment for middle ear infections, but are used to treat otitis externa or external ear infections. For a 1-minute video about the medication your doctor prescribed, including common side effects, check out the medication playlist on the Patient Education Solutions YouTube channel. Because of the pressure buildup that has already occurred, is it important to minimize things that can increase this pressure further and the risk of causing a ruptured eardrum, such as sneezing through an open mouth. Do not hold your nose and try to pop your ears, such as if you're on an airplane. If your doctor says that there is a severe bulging of the eardrum, you may consider avoiding deep diving or air travel. Additionally, take medicines that can help to decrease or minimize coughing as well. We fully anticipate you to improve with the care provided here today, as well as continued care at home. However, it usually does take a few days to get back to normal, and you may continue to have ear pain for the next 24 hours or so. Additionally, after the infection clears up, the fluid may persist and for several weeks, and it's important to follow up with your primary care physician to ensure this fluid has gone away or resolved. There are some signs and symptoms that indicate you should return to the emergency room, and these include recurrent fevers over 104, despite being on antibiotics, new symptoms such as swelling around the ear or weakness of the facial muscles, symptoms and pain getting worse and not better, fluid or drainage or blood from the ear canal, neck pain or an inability to flex the neck or bend the neck, confusion, seizures, or difficulty walking. If you experience any of these or are unsure and want to be seen, seek care in your nearest emergency room. We believe that educated patients are the best patients, so please ask any questions before you leave, and I hope you get to feeling better soon.